Welcome back. It's still Morning Rush on Metro Television. We are live on DSTV channel 277, live on Facebook, and YouTube is Metro TV Ghana. Don't forget to follow us on Instagram, Metro TV_GH. Like we mentioned earlier, we'll be talking about Joseph S. AGYEPONG Distinguished Lecture, and we have two big lady and gentlemen in the studio. I'll introduce them. I'll take my time. We have Professor Kwesi Tope, who is the Dean of School of Public Health, University of Ghana, and also Dr. Efua Kome is a public health expert in clinical care and community practice. Good morning and welcome.
Good morning.
It's good to have you.
Thank you.
Before I come to the Dean to share a little bit of his experience, even prior to joining the university and everything, let me come to you, Doc. In your bio, it says you are a specialist in expert in clinical care and community practice. What exactly is that?
Okay, so as a public health specialist, you usually start by working in the clinic. So every medical doctor after school, you would be posted to do your house job, become a medical officer and then work in the clinic. But moving beyond that, then you specialize.
Okay.
And I did specialize in public health.
Okay.
So public health is just an extension of medicine beyond the consulting room.
Oh,
so you move into the communities.
Okay.
Look into community care. You are looking at prevention of diseases. You are looking at screening activities. You are also looking at even diagnosis within the communities before people approach the health system.
Okay.
Exactly. So you train the health workers to pick up the diseases early and take home visits, community practice, also train them to do screening amongst a whole lot.
Wow, that's a lot. But then what inspired your interest in healthcare?
Definitely wanting to improve health outcomes, because generally people's experiences with the health system are not the best. So you hear about somebody went to the hospital, they didn't get enough communication from their doctor or from their nurse, and you are always wanting to do something about it. But you cannot just do something about it by becoming a doctor and sitting in the consulting room. You'd have to move beyond the consulting room into the community where usually the problems are, and that is where the cases are going to come from before they get to the hospital.
That's very good. Prof,
Thank you.
let's delve a bit into being the Dean of the School of Public Health. How has it been over the years? How did it all start? Let me start there.
So I would say my career basically started working for government. So Kolebu, Rage Hospital, Police Hospital. And then I got involved in international development, that is public health in Africa. So worked in several countries in the Africa region, advancing public health. And then I moved back into academia to build capacity of the next generation of our public health professionals. So our role essentially is to train cadre of healthcare workers to be able to advance the public health agenda in this country.
Over the years, what have been some of the changes in your department?
So I think in terms of the training, you can see that the health system in Ghana is evolving. The diseases that we see is also evolving. And it's important that the new generation of professionals that will train are equipped to be able to address these challenges.
That's very interesting. I wish I could go on and on and on because the bio seems packed and is very interesting. But then let's talk about Joseph S. AGYEPONG Distinguished Lecturer. What exactly is it?
So the Joseph S. AGYEPONG Distinguished Lecture was actually instituted and hosted by Harvard University Center for African Studies about 3 years ago. So the first actually lecture was given by the then director of Africa Center for Disease Control, Dr. John Nkengasong. He's currently the U.S. President's Initiative for AIDS Relief in Africa, the ambassador. So he gave the first lecture on public health order, the new public health order in Africa. And this distinguished lecture is basically to recognize people who have contributed significantly to public health in Africa. So it's been going on. We've had the second, and now we have the third. And given that the University of Ghana is 75 years this year, Joseph S. AGYEPONG is a Ghanaian. And we felt that it's important to collaborate with our colleagues in the Harvard University, because this is jointly organized Harvard University Center for African Studies. So now we want to bring this lecture home. And we are actually focusing on a very, very important topic, that is combating non-communicable diseases in Africa. And my colleague will speak a bit more about non-communicable diseases in Africa and then in Ghana.
Yeah. Before we talk about that, let's take the man himself and talk a bit about him into detail. Who exactly is he? What did he do? Other things that he was involved in. Let's get into that before we talk about the communicable diseases.
Maybe let me get, I think in terms of, I think even within this country and in the Africa region, his contribution to public health, sanitation, training, educational. So it's a whole range that, and I think it's important that we recognize what he has done for the community, for the country, and also at the international level in terms of advancing public health, prevention. We all know that most of the diseases that we face today are preventable. So if we really focus on the prevention, then a lot of the problems that we have today may be addressed.
Let's come to Dr. Ifeakome. Like, what are the communicable diseases? Take us through it and tell us the effects, the challenges, and the problems that we continue to face.
Certainly. So over the past couple of decades, traditionally we know that for African countries, we are more burdened with infectious diseases. So you talk about cholera, malaria, HIV, and these are commonly known. But over the past few years, we've realized that in addition to that, we've also been burdened with pandemics, sort of. So the very recent COVID. Then beyond that, there are multiple outbreaks, Marburg, you name them. Currently, we are even having anthrax in the north.
Latest one.
That's the very latest. However, due to our changing, there's a whole transition that we are going through. And that for that transition, our lifestyles are changing, the kinds of things we eat, the sort of socioeconomic activities we are involved in are also changing. And then also, it's also reflecting in the sort of diseases that we are currently recording, even in Ghana. The non-communicable diseases are diseases which are not transmissible. So you develop it, but if you cannot transmit it to the next person, it occurs over a long period of time. So some people call them chronic diseases. And others also call them lifestyle related, because most of the risk factors are related to the lifestyles. Examples include hypertension, commonly, and diabetes. We have the cancers, breast cervical cancers, childhood cancer, and then even prostate cancers. And then things like asthma and the other chronic respiratory diseases. Now, these diseases have been noticed to be on the rise in Ghana, not just in Africa. In Africa, it is also on the rise, but particularly for us in Ghana. And it's recorded in almost all facilities across the country. When you compare year on year, so comparing from, let's say, the early 2000s to 2010s to currently, they are constantly on the rise, and it's essential that we start talking about them. However, it's a bit difficult talking about chronic diseases because they are not as dramatic as infectious diseases. So compared to somebody getting cholera or even malaria, you are getting the fevers and chills, and you would run to get a solution to them much faster. These chronic diseases occur sometimes over decades. And when they start, you almost have no symptoms at all. So for something like hypertension, it's called a silent killer. When it is rising, the person would not notice because there are no symptoms until somebody decides to check the blood pressure. As a result of that, when you're talking to people and they don't feel sick, it takes a lot more to convince them that something could be going wrong.
Even when people come up to say, oh, let's check our bodies, do screening, free screening.
It looks like a bother because, after all, I'm fine. I walked from my house, came to the office. I'm going about my normal duty. So people do not see the urgent need to find out. And in Africa, we say that when you don't go poking in corners and you don't find out things,
what you don't know won't kill you. What you don't know won't kill you.
Would rather not know, exactly. So we really need to sensitize people to the fact that the dynamics are changing. Our whole health terrain is changing. Currently, non-communicable diseases are accounting for about 43% of all-cause mortality in Ghana. So for all our deaths, if you put them together, the NCDs are causing about 43%. That is even minus the injuries. So you see as many road traffic accidents that we have, if you add them, it's about 53%.
That's
More than half of our deaths are coming from these diseases, and yet we are not talking about them enough.
Before we touch on like the event and everything, let me just ask this: if, from what you said, if our lifestyle changes, can it get better?
It can.
Okay.
It can, because there are proven strategies that can be used to combat these diseases.
Okay.
So things, we didn't talk about the risk factors, but things like physical inactivity, not exercising enough, literally, or unhealthy diets, cigarette smoking, alcohol intake. You know, sometimes back then, you say, oh, some small bit of alcohol is good for the system.
Yes.
Current studies show that all alcohol is dangerous. Any amount of alcohol. And we also have the added burden of air pollution that affects the respiratory system. So the risk factors are all around us. And it's essential that we talk about them for people to realize that they are causing diseases in others. And then even when, some time back when you talked about things like stroke, you were expecting them in a 70-something, 80-something year olds. Currently, we are getting 30-year-olds, 40-year-olds coming down with strokes. And before you'd get a stroke, it means that you'd have had a hypertension for years, for a while, and nobody checked. So the person did not know. And the first time they get to hear is when they collapse and are rushed in. And we're having all the water shocks and things pasted all around. So it's here with us, and it's important that we are able to address them.
And talk about it.
Certainly.
So that's why we are having this talk. So what's the theme and who are the speakers?
So the topic is on combating non-communicable diseases in Africa. And the keynote speaker would be Professor Peter Lamte. Professor Peter Lamte is a Ghanaian. He's a professor of global non-communicable diseases and an emeritus president of Family Health International, or FHI 360. So the event would be hosted by the Vice Chancellor of the University of Ghana, and then the chair will be the Director General of the Ghana Health Service, Dr. Patrick Kumar Abuaji. And we would have, in addition to Professor Peter Lamte, we have Dr. William Bosu. He used to be the program manager many years ago of non-communicable diseases in Ghana. He now works with the West African Health Organization. And then we'll have a panel. The panel will be made up of Dr. Efwakome, and then we have Mr. James Amwa, who is with the Ghana Public Health Association. And we have Dr. Jifa Atta, who is works with the University of Ghana Medical School Department of Psychiatry, who would cover the mental health aspect. And then finally, we have Dr. Fidelia Dake, also from the University of Ghana. So these will be the speakers, and we are actually going to have it at the University of Ghana Study Conference Center. So that's in the Department of Economics. So, I mean, it has a lot of space, so we are really encouraging all of you to attend on the 28th at 5 p.m. Yes.
And 28th is Wednesday.
It's a Wednesday.
It's a holiday.
It's a holiday. Yes. So that's why it's in the evening.
Time.
5 p.m.
5 p.m.
So everybody should be seated by 5 p.m.
No Ghana man time.
Yes.
Just be seated, because they are distinguished and big people there to talk to us. But finally, before we rush and go, what do you want people to take out of this whole distinguished lecture? What should people take home?
For us, it's essential that we realize that even though these diseases are here with us, something can be done about them. It's crucial. Even for our children, you know, we called them lifestyle diseases. However, habits are built over time. And once the parent starts living healthier, they are exercising more, they are eating healthy diets, you inculcate them in the children as well. So it becomes a normal part of their lifestyles. And they won't grow up looking at, let's say, fast foods as reward systems, such that when I do well in school, then you have to take me to
Papaya. I shouldn't have mentioned it, but you get some fried rice and kebabs and
exactly.
things.
that reward system sort of skews their mind towards looking forward to these fast foods as against eating healthier diets, which at some point look more like tedious. It's like it's a punishment for you to tell me to eat my vegetables.
Yeah.
Sort of. So we need to incorporate healthier lifestyles, especially in the youth and even for the adults. For those who have already been diagnosed, it's essential that you continue taking your medicines, also adopt healthier lifestyles, because some conditions can actually be reversed. Others can be very well controlled, such that regardless of your diagnosis, you live very normal lives. People give up once they are diagnosed. You are told you have diabetes and it's like it's the end of the world. It is not. There are things which can be done about them. So we need to continue sensitizing ourselves about these non-communicable diseases. As we are not living in isolation, just like the whole global community, it is here with us.
Thank you very much. This morning, it's been very insightful. It's been all about the Joseph S. AGYEPONG Distinguished Lecturer. And this morning, we have Dr. Efua Kome, who is a public health specialist with experts in clinical care and community practice. And we had the Dean himself, the Dean Kwesi Tope, who is the Professor Kwesi Tope, who is the Dean of the School of Health Public, University of Ghana. I had to say it very well. Thank you very, very much, and it's been a pleasure and delight having you here.